to assess the degree of harm alcohol does to the human body, you first need to understand how it is metabolized. When a person consumes alcohol, about 10% of it is absorbed right in the mouth. The remaining 90% of alcohol is then absorbed directly in the organs of the gastrointestinal tract. 90% of the detoxification and neutralization of alcohol is handled by liver cells, that is, by the parenchymal organs. In this case, it's mainly the liver, where alcohol is converted into its final products, acetaldehyde and acetic acid. And all these products are excreted by the kidneys. A person can simply go to the bathroom, and over time, it all leaves the body. In addition, alcohol is also eliminated through the lungs and skin. About 5 to 7% of alcohol intoxication is removed by these organs. Naturally, with prolonged and, let's say, regular alcohol consumption, all these organs responsible for protective functions and neutralization simply can't physically keep up, and a number of symptoms and problems arise. If we take the liver, the first thing that happens is alcoholic reactive hepatitis, which over time develops into steatohepatosis or fatty liver. And fatty liver is a precursor to cirrhosis. If a person doesn't stop and doesn't address their alcoholism, naturally cirrhosis of the liver develops and later on, liver cancer. If we look at the lungs, alcohol affects the alveoli and the very structure of the lungs. This leads to frequent bronchitis, the onset of various viral infections, pneumonia, and so on and so forth. If we take the heart as an organ, again, alcohol affects the heart, specifically its muscular function. The pump function also has a negative side because it, let's say, burns out sodium and potassium ions in the body, which creates an imbalance in the neuroimpulse transmission system, and various types of arrhythmias can arise, including fibrillation or asystole of the heart muscle. The brain is under tremendous impact because, as I mentioned earlier, there is a deficiency of vitamin B1, thiamine, and encephalopathic conditions can develop. Of course, alcohol also has a very strong teratogenic effect. What does that mean? It means that if a future mother drinks alcohol for a long time and then becomes pregnant and plans to have a child, the chances that the child will develop some kind of genetic or chromosomal disorders increase by 150%. Because alcohol also affects the smooth muscles of the female reproductive organs. That's why the teratogenic effects of alcohol have been studied for a long time and play an enormous role when planning a pregnancy.